I'm Kelly Cole, President and CEO of Sunnybrook Foundation. It's an honor to welcome you to Sunnybrook Foundation's Virtual Impact Series. Tonight, you will have a front row seat to learn how Sunnybrook is inventing the future of precision medicine. And you'll hear from these three panelists who are of many great leaders in the Hurwitz Brain Sciences program, the Schulich Heart program, and our newly formed Precision Diagnostics and Therapeutics program. I want to first begin with an acknowledgement on the land, on which we work and live. We recognize that many Indigenous nations have long-standing relationships with the land upon which the work of Sunnybrook and Sunnybrook Foundation is conducted. Sunnybrook acknowledges our campuses are located on the traditional territory of many Indigenous nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today, this land is home to many diverse First Nations, Inuit, and Métis peoples. And we are grateful, I'm personally grateful, to have the opportunity each day to live, work, and gather on these territories. Land acknowledgements like this one are only a starting point for larger conversations, which Sunnybrook is deeply engaged in. Tonight, as we learn about the future of precision medicine, you are going to hear the words personalized and precision quite a lot. The ultimate goal of precision medicine is to target the right treatments to the right person at the right time. This promises to reduce uncertainty for patients, often during the most uncertain moments of their lives. Before we get started, I have one request of our audience, you. There will be moments tonight when you feel inspired hearing about what Sunnybrook is doing. In those moments, think about how you factor into that work, how your generosity puts Sunnybrook on the leading edge. And with your continued support, you can ensure the future is invented right here at our hospital. There are few places with teams like Team Sunnybrook. Our teams are uniquely prepared and counted on to treat the province's most challenging and complex cases. And our teams, including our three panelists, are conducting research that will change the world. So without further ado, I know that you are eager to hear each of them speak. I'm going to call on them to now take a few minutes just to introduce themselves. Why don't we start with Dr. Courtney?
Hello, everyone. Thanks for joining this evening. My name is Brian Courtney. I initially trained as an engineer in computer engineering and electrical engineering at both Waterloo and Stanford, and then got into medicine, trained and did medical school at Stanford, but I've been here at Sunnybrook now for almost 20 years. All of my internal medicine residency, cardiology residency, and interventional training has been here. And I've been on staff now for almost 10 years.
David?
Thank you, and thanks everyone for joining this evening. It's a real pleasure to be here. My name is David Huang. I'm the Chief of Laboratory Medicine and Molecular Diagnostics at Sunnybrook and co-chief of the new Precision Diagnostics and the Therapeutics program here. I did pretty much all of my medical training and residency in pathology in the University of Toronto system. Worked for about 15 years down the street at University Health Network, and was recruited here in 2018 to Sunnybrook to become the chief of the Laboratory Medicine Department of Laboratory Medicine Molecular Diagnostics.
Great, and Joanne?
Hi, everyone. Good evening. My name is Joanne McLaurin. I am a chemist by training, and then during my studies got interested in the brain and did a bit of a switch and became a neuroscientist so that I could study what was going on in the brain. I have a PhD. I'm a basic scientist in the Biological Sciences platform and the Hurwitz Sciences brain program here at Sunnybrook Research. I've been at Sunnybrook for the last 8.5 years. I spent time downtown, was recruited up here, and Sunnybrook, Team Sunnybrook is a great place to be.
Thanks. Thanks to all of you for the introductions. Out to the audience, as our discussions unfold tonight, if you have questions, I would encourage you to use the question function. On my screen, it says Q&A in Zoom to ask any of your own questions. And we will do our best to answer as many as we can towards the end of our time together. So to kick off, let's hear from our panelists on what precision medicine looks like in each of your fields. And Dr. Huang, why don't you start and tell us about the newly created Precision Diagnostics and Therapeutics program at Sunnybrook?
Certainly, Kelly. So Precision Diagnostics and Therapeutics program, as the name implies, is one of the clinical programs at Sunnybrook that is really entirely focused on trying to advance precision medicine. Here, I'm tremendously excited about this program. As I mentioned, it's the newest Sunnybrook clinical program, so that's the 10th program here. And it brings together both of the large diagnostic specialties, one being laboratory medicine and the other being medical imaging. And it's really the first clinical program in Canada to do so. And when I talk to my colleagues in laboratory medicine, I mean, they all kind of remark on, well, that's quite innovative. And the whole point of this is to really try to build synergies between the diagnostic specialties to see how can we advance precision diagnosis and treatment of patients. So how can we do things in ways that are sort of less invasive for patients? So for instance, rather than, let's say getting a biopsy, can we sort of move things forward through a blood test instead? Can we maybe look at ways that medical imaging, if you get a CAT scan, can we apply artificial intelligence to predict, are there going to be, biomarkers in that analysis of those CAT scan images that would say that, this tumor might respond well to a certain kind of treatment. So this program really is about trying to develop those kinds of synergies to advance the field of precision medicine.
Great. And why don't I shift over to Dr. Courtney to just share a little bit of what precision medicine looks like in your area.
Yeah, so in cardiology, we do a lot of different kinds of procedures. We do angioplasty and stenting to fix coronary disease, ablations to treat heart rhythm disorders. A lot of valvular interventions take place at Sunnybrook. And, part of precision medicine is making sure that you have the right diagnosis. A lot of things can cause a vessel to get blocked, but they might have very different treatments. Sometimes it's atherosclerosis, sometimes it's a thrombus, sometimes it's a default in the genetic makeup of what the vessel architecture is like that causes a vessel to dissect spontaneously. So there's a number of areas where making the right diagnosis is incredibly helpful. And then once you have the right diagnosis, you want to make sure that you put the right size of the right device in the right patient at the right location, and that you've done a good job of it. So one of the things that I've been fortunate to develop that I've been able to use in my patients at Sunnybrook is a catheter that's 1 millimeter in diameter, and you advance it into the artery the same way that you would advance a balloon or a stent into the artery. And it takes pictures with ultrasound and optical laser type imaging to be able to get very accurate measurements and feature detection of what's going on inside the artery before you commit to putting a stent in or reverting to surgical revascularization. And by doing that extra level of detail beyond what a standard angiographically guided angioplasty would be, which just uses X-rays, and the measurements for X-rays and angiograms, it's a little bit of a thumb. So you look at the picture and you sort of say, oh, it looks like it's about a 2.5 millimeter stent we should put in there. But when you actually measure it and you know where you should start and end the stent in the vessel, you can actually reduce bad outcomes by 50%. And so this technology was actually, the ultrasound for these cameras was initially built here at Sunnybrook in the 80s. got commercialized in the United States in the 90s. There's an optical version that got built in the late 90s out of Harvard. And what we've done at Sunnybrook was we took our ultrasound expertise and some of the local optical imaging expertise, and we put both of those on the same catheter so that when we go in there and take pictures with our system, we're not just doing angiography, which is the standard, but we're also doing ultrasound imaging and optical imaging to get the most information we can before we go ahead and put a stent inside a patient's heart. So, that's an example of precision medicine, but there are a lot of other examples where we're really advancing things for some of the other procedures we do in the program as well.
It's wonderful. Thanks, Brian. And we'll just shift over to Dr. McLaurin. And, there's quite a few buzzwords in precision medicine. I know I'm getting my head around them. Words like organoids and biomarkers. And Joanne, maybe you can tell us a little bit about organoids and what promises it holds relative to precision medicine.
Love to. So research can contribute greatly to the advancement, not only of new drug discovery, but for precision medicine. The team here at Sunnybrook is developing and building three-dimensional little organoids from the blood or skin cells of an individual. This new technology that is growing quickly, it's advancing. We are learning more about these little organoids, has immense promise. And the reason it has such immense promise for precision medicine is because we take an individual cell and we make a little organoid, whether that is a small brain or a liver or a tumor, and we bring your specific genes along with it. So anything in your genetic makeup that affects the disease, we have with us. Not only that, your genes also carry marks that are part of your life experiences. So the things that you've gone through over your life. So those marks come with your DNA as well. And those also affect how you respond to treatment or how your disease process occurs, whether it's fast or it's slow. And organoids retain this information, and we've never had that ability to do that before. Before this point in time, we would use rodents to do the experiment, and no one has to explain to anybody a rodent is not a human. And so although it can mimic parts of the disease, it can't mimic all of it, and hence why these human organoids are so important. Sunnybrook is already at the forefront of this research. We are developing organoids for a range of human organs, the brain, the eye, the liver, the kidney, but we're also doing tumors at the Odette Cancer Center. And this will serve as a foundation for exploring disease processes as well as new treatments. I'm going to tell you a little bit about the stem cell and organoid facility that we have presently. Hand in hand with our donor community, my two colleagues, Dr. Sandra Black and Dr. Carol Shermans, the three of us envision a facility where we will be able to increase our ability to generate these high quality organoids from people with dementia and other problems due to degeneration, whether that's in the eye or in the brain. And we hope that by developing these organoids, we can start to develop groundbreaking understanding of an individual's disease pathway and how dementia is affecting that person. The vision is that by having the capacity to generate more, we can target more individuals rather than looking at a disease as a population. We can look at it individually. So how your personal experience will be. Lastly, once we have these organoids, we can, if in dementia, sadly, we don't have this, but our friends in cancer do. So if you made a cancer tumor organoid, we could then put them into the dish and we can apply all these different potential treatment options to them and decide which one works better for you. I like to use the analogy that when I get a headache, I like to use ibuprofen, but many people like to use Tylenol or aspirin because that works better for them. And that's what organoids has the potential to do down the road.
Thanks so much, Joanne. And David, just building off of Joanne's content around both organoids and furthering into biomarkers, maybe you could talk a little bit about that and the work in both Dan Women and Babies and the Odette Cancer Center.
Yeah, for sure. So biomarkers are basically just something that's measured that tells you something about a disease process, whether, for instance, what that disease process may be. But more and more, especially in the cancer realm and in our work with the Odette Cancer Center, we talk about predictive biomarkers in terms of, some sort of measurement that will tell us whether the tumor in question will respond to a targeted treatment. And these are treatments. When you think about treatment of cancer conventionally, stage 4 disease, patients usually or very often have to go through chemotherapy, which is quite toxic and has kind of a wide range of side effects. These targeted treatments more and more are being developed that, would actually be much more specific at targeting the tumor and having sort of much fewer side effects, so that they would actually have much better effect on treating the tumor and sort of fewer side effects, much better tolerated. So there's a lot of our work together with the Odette Cancer Center is in determining genetic variants that might predict response to some of these targeted treatments. And over the past 2 or 3 years, it's been a tremendous amount of work in our clinical lab to get this testing up and running for these specific biomarker tests, to the point that Sunnybrook over the past couple of years has grown actually into one of the larger testing centers in the province and kind of major referral center for South Central Ontario to do this biomarker testing. So that's kind of one tremendously exciting aspect of being able to select treatments more specifically that are targeted to patients based on their genetic makeup. At the same time, we've been developing biomarkers, not just to say what kinds of treatment a patient should be getting or that they may benefit from this targeted treatment. We're also starting to look at how genetic makeup of certain individuals might tell us that they shouldn't be getting a certain treatment. So for example, Sunnybrook recently has been the first lab in Ontario to offer a genetic test for patients who are undergoing treatment for a certain kind of chemotherapy for colon cancer. And for patients who have a specific variant of this gene, they should probably get a much reduced dose of the chemotherapy, or maybe avoid that chemotherapy altogether because it can have extreme toxicity. And I actually just a couple of weeks ago heard from one of the oncologists who was very thankful for this test because they were able to reduce the dose of chemotherapy for a patient and actually see an effect. And had the patient not had the test, they probably would have ended up in hospital to deal with these side effects. So in cancer, that's certainly a very active area right now, both in terms of what targeted treatments a patient can get and maybe what sorts of treatments they shouldn't get. But this sort of biomarker testing extends beyond cancer to other areas as well. You mentioned the Dan Women and Babies program. A couple of years ago, Sunnybrook was first in North America, first lab in North America to implement kind of a new panel of tests, blood-based biomarker tests, to predict patients who would have a poor outcome in preeclampsia. So that's a condition in pregnancy where there's high blood pressure and there's a risk of bad outcomes both for the mother and the baby. And so being able to implement this test helps the clinicians in that program to decide, okay, which patients actually need to have more intense treatment or observation and which probably will be okay. So, I mean, it encompasses multiple programs. I mean, Dr. McLaurin talked about dementia, and certainly we're working on blood-based biomarkers now to, for the detection and so early detection and prediction of Alzheimer's disease and dementia. So it really is an exciting area with potential application across multiple clinical programs.
Great, thanks, David. All three of you have kind of commented a little bit on this next question in your discussions already, but maybe take us a little bit further. How do patients at Sunnybrook today benefit from precision medicine in a way that wasn't possible a few years ago? And Brian, why don't you kick us off?
Sunnybrook's got a very active structural heart program. And when I started my training, people with certain valvular conditions would have a very poor prognosis. They would be 80 years old, their heart couldn't pump blood out, and they would have a high mortality rate in the next 2 years and suffer through that. And we now replace heart valves in patients who you couldn't do that before. We do that 400 times a year through a small incision in the leg. And to do that properly requires a lot of accurate measurements of the size of the structures in the heart where you're placing this valve to avoid complications, to help do all the surgical planning or procedural planning. It's not really surgery. It's more minimally invasive. And, a surgery that would have had 10 years ago a 10 to 15% mortality rate in someone at the age of 80 to 85, and been in hospital for 1 to 2 weeks to recover, if they recovered. We're now doing those procedures. Some of them are going home the next day, some are going home a few days later. But it's remarkable what you can do when you know that you're putting the right device in the right place. So that would be one of many examples. I think we also run into patients who might have something that looks like a heart attack or smells like a heart attack. And then you go and you look at the angiogram and you don't find any blockages. And this actually became very relevant during COVID because some people who got the coronavirus would end up getting an infection or inflammation of the heart. And we can detect that through MRI imaging. There's certain patterns that you can see where things that weaken the heart muscle that are not related to the most common cause, which is atherosclerosis, we can pinpoint with MRI and drastically change how we decide to treat these patients and be confident that we have the right diagnosis, not expose patients to medicines that don't help, and do expose them to medicines or other treatments that will help them.
Brian, your examples are very close to my heart. My father had open heart surgery, always had challenges with his heart over the years and a couple of decades actually. And those open heart surgeries, spending a week or more inside the hospital, long recovery periods. So it's amazing the progress, and I know impacting just a number of individuals and their families, and how fast they can be in and out, but more so the less invasive treatment is so incredible to the whole body.
And there are times when an open heart surgery is the right thing to do. But when you do an open heart surgery, you want to be able to predict how well they're going to recover from it, and that you really need to go down that path to do it, so that you know that investment in terms of patient's time, patient suffering, and all the resources that go behind it from the hospital. When we have so many things we have to juggle in our ICUs these days, it's critical to make sure that we tee those things up nicely. And that's one of the reasons why our cardiac surgery team has one of the best track records in Canada, if not North America.
It's great progress. So let's hear from all three of you now on how we, our audience, our donors, our volunteers, how can we help? And David, do you want to start off?
Yeah, certainly. Yeah, I mean, I really cannot understate just the importance of our donors in helping us get precision medicine off the ground, certainly in my area, but to help us continue to develop and stay ahead of the curve with this. I mean, one example, when I first came to Sunnybrook, I think one of the significant reasons for recruiting me here was actually to get our precision diagnostics testing for cancer off the ground. At that time, we were sending out most of our cancer specimens for precision diagnostic testing, and the wait times for the tests were, 4 weeks, 5 weeks, which was just too long because, a lot of our cancer patients were quite sick and they needed a decision for treatment very quickly. So when I first started, there was a new technology that had just come out that would enable us to reduce that wait time and offer the test on site with a turnaround time of maybe about 72 hours instead of 4 or 5 weeks. And I remember thinking, oh, well, this machine is going to cost us about $100,000. So, good luck with that. But working together with Dr. Kelvin Law at the Odette Cancer Program, he was able to secure a donation to cover the cost of that machine and to help operate it. And so we were actually very quickly able to reduce our wait times just dramatically for cancer patients for some of these precision diagnostics. From like 4 or 5 weeks down to like well under 1 week in many of these cases. And that really continues to make just such a significant impact in the lives of so many of our patients day to day. And actually, I think as word got out that we have these really fast turnaround times, that's how we actually grew from having sort of no on-site testing presence for these kinds of tests to becoming one of the largest referral centers in Ontario for this sort of testing. And it's really been quite a bit of a ride, going over the past 3 years, getting this all up and going, because the field is just moving at such a tremendously fast pace. It seems like every other week there's an announcement of a new biomarker that needs to be tested for a new drug that's coming out for this sort of cancer patient with this sort of genetic variant. And our lab, I've been kind of, I liken it to trying to build a high performance aircraft while you're sort of in mid-flight and trying to put the pieces together and assemble while you're actually flying. So just to be able to stay ahead of the curve with the technology that we need to be able to, be able to purchase the reagents that we need to kind of stay ahead of the curve and be able to offer the kinds of testing that we need to offer on a timely basis. Our donors have been just instrumental team members in helping us do that.
Well, I'd love to hear the collaboration as well, Dr. Huang, just between your new program, but closely connected to so many of the programs like the Odette Cancer Center, and seeing that partnership between yourself and Dr. Law and extending out into the donors. And I find that it's a really amazing team that comes together, including our donors being a part of that team and making something amazing happen. So thank you for sharing that. Joanne, why don't we go to you next?
Okay, before I jump on your question, I just want to make one point. So I'm going off script here, but David and Brian both made points that I'd kind of like to bring up and on precision medicine and pull some things together, at least from my perspective on dementia. David had said they're trying to get this blood test for Alzheimer's disease now, so we can do it non-invasively. And Brian's the imaging expert, and we have made such great advances in imaging to be able to actually identify what type of dementia patients really have, because there's more than Alzheimer's disease. That's just a small population of people who come in, and yet they may have very similar symptoms, but this allows us to segregate people out to the cause of their dementia, not just as an umbrella. And on that point, 10 years ago, we were doing clinical trials, and it turned out at the end of the day, if people passed away and we were allowed to look at their brains, they were in the clinical trial for Alzheimer's disease and they didn't have Alzheimer's disease. So it's not too surprising that that drug did not help that individual. And so this collaboration between the biomarkers and the imaging and the scientists brings us together that we can advance personalized medicine a little farther. And if we get back to the organoids, And the research side of things, philanthropic report is helping us, and it's critical right now for us to establish this facility and help us to grow. Because only by being able to grow, will we be able to make these connections and answer these questions for individual people. The other thing the donor money does, it allows us to leverage that for other granting options. And I think it's something we don't talk about a lot and people don't realize, but that your dollar can go so much farther. If you give us dollar, we can leverage it, whether it's government grants or other foundations who are willing to give us money. And I think that's a huge support that people don't always think about. So with respect to, again, to Alzheimer's and disease in the brain, as we age, and I talk about all of us, we normally don't have a single disease. So we're not an individual that only has Alzheimer's disease. Very often people have other diseases in conjunction, like hypertension or diabetes. And we're starting to understand that the peripheral diseases that we have also affect the brain. And so just having Alzheimer's, if we just treat your Alzheimer's disease and your periphery isn't treated properly, then you're still hurting your brain. And so sometimes when you have two diseases, 1 + 1 does equal 2. But with the brain, sadly, 1 + 1 sometimes equals 3. And so organoids can help us start to dissect those comorbid diseases out, because you have all that information embedded within your own cells. And therefore, we can start to understand how that 1 + 1 actually equals 3, such that we can treat you better. I like to think of it, put myself in someone's shoes who has this disease, and what would I like to know at the end of the day? I'd like to know the answer to what's wrong with me. I would like to know the answer, what can we do now that I know what I have and understand what I have? And will the treatments work? And hopefully they do for everyone. So we like to frame this more as I'd like to understand, and I think you would as a patient or a caregiver, is what really is individually wrong with someone, and let's treat that individual. I think once we understand these pathways, it will open up all these different targets that we can then develop drugs. And then we can test these drugs back again on your own organoid and not on someone else's. And that's where I think donor money comes in, and that's where donor support is very important.
Joanne, I was just going to build off your comments about, how donor funding sometimes leads to further funding. And so oftentimes in research or in clinical trials, that sort of thing, funding from the donor can get proof of concept that might lead to a government grant, in addition to other types of grants that come from public or private foundations or other donors. But also donors tend to inspire other donors. And I think in your case, in particular on this organoid facility, we're hoping to bring together some community of donors that will support this effort. And it's that community of donors that together that can have an impact. So sometimes donors also inspire other donors to get engaged. Brian, what about for you?
Yeah, I've seen donors have a huge multiplier effect through a number of different avenues. One of them certainly is the matching for various grants. Also, these grants, they have a cyclical nature to them. And sometimes you've got a great team and you've been working on something, but your funding only goes until, say, March of the year, and you're not going to get the next grant until September. And there's this risk of your team falling apart, or another opportunity that you really want to pursue, but you don't have enough data to really do the initial grant application for, or initial patent application for. And so having some money to smooth out between those barriers helps you to be able to basically keep things moving, keep things productive, not build up and then tear down and then have to build up again. And so that continuity, I think, is very helpful. another spot where I personally enjoy, one of my activities I personally enjoy as an assistant professor in the university and at Sunnybrook is teaching. I look at that as, a way of having a multiplier effect as well. And one of the things that we've done with the startups that have been created, of which I started one company called Canavi, which commercializes that device I told you about earlier, that does imaging inside the arteries. But we created a program to teach people how to do medical technology development and commercialization. You can do engineering, you can do medicine, you can do business, you can do science studies. But if you don't have a curriculum and an environment that's supportive of giving you the industry-specific guidance on how do you build a new technology that will have market impact and patient impact and economic impact, bringing those things all together is important. And we created a program called Medventions, which has taught 35 graduates so far how to go through that process. And they're out doing really good things in industry and in research and in clinical work to develop new medical technology innovations. And so that will further amplify things going downstream. And that was heavily funded initially by donors. We've now gotten some very significant government money to support that program as well, which is giving it some legs. And we're branching out to Eastern Canada and Western Canada with it as well. So, that's exciting to be able to kind of be the seed that starts something that then percolates across the country, with Sunnybrook as the fulcrum for where this all originated from. And then there's the usual, if you pick a theme that's really of personal importance, maybe it's image-guided therapy, maybe it's cardiac disease, maybe it's cancer. But picking a theme and being able to contribute to that particular theme can be very helpful to advance a particular field of interest to the donor forward.
Yeah, those are all very good examples, Brian, and I love when we, get support for, the trainees, that educational component. Those individuals are obviously contributing to the research that's being undertaken and learning along the way, but they become, such a great resource for us, for Canada, in the decades ahead, and such an important part of what Sunnybrook does for the whole healthcare system, in addition to advancing obviously the research. And love the Medvention program. It's great. So we'll shift now into some of the questions coming from the audience. If individuals out in the audience do have questions, please feel free to submit. I know I've got a couple here. So question one for all panelists, what could healthcare delivery and patient experience look like in 5 or 10 years as we continue to advance precision medicine? So what could healthcare delivery and the patient experience look like in 5 to 10 years? And I'll wait for someone. Brian, you're jumping. Good.
I think, people are starting to know more about their conditions. They want access to the data of their health records. They want their own, there's ways you can treat people, and sometimes you might have methods that are equally effective. And a physician might direct them to one path or another based on what they're most familiar with. But spending more time with the patients and less time working through some of the technical details or the medical details is, I think, one of the potential opportunities that things like artificial intelligence can help, giving us more time to say, hey, we know what we could do or what the options are. Let's now spend more time with our patients to apply their values and preferences to the decision-making process about how they move forward. I think that's one. I think increasingly outpatient care delivery and more responsive care is important. We're going to fill up these hospitals very, very quickly if we keep treating people the way that we did 10 years ago. And a lot of things can be managed with shorter hospitalizations and closer day-to-day follow-up to have more care outside of the hospital. Now, there's some things you can't do that for. You can't do that for severe trauma. Certainly, people at certain courses of their disease need to be in hospital for very close monitoring and support. But there are a lot of things that we used to do in hospital that can be very effectively done on an outpatient basis and a more comfortable basis for people, and a more supportive basis in many circumstances. So I think that trend is something that is enabled in part by technology and in part out of necessity, and in part out of patient preference.
Great, thanks. Thanks,
I'm
David.
gonna-
Oh, Joanne, go ahead.
Sorry. I was just going to jump on Brian's because the Hartwell Center for Neuromodulation popped into my head as Brian was talking about non-invasive or minimally invasive therapies. They're a world leader in ultrasound delivery of drugs, and they're just at the beginning of their pathway of being able to actually access different parts of the body without a knife, without opening the tissue. And for me, working on the brain, it's absolutely crucial because we have this thick skull you have to get through in order to actually reach the brain. And sometimes if you need somewhere deep in the brain, you have to go through normal tissue to get there. And that's also damaging. I mean, the Hartwell Center, they're on the neuromodulation. They're also developing devices that you can take home and you'll be able to use to stimulate your own brain at home to get those connections back to keep your cognition. I think it's going to be amazing.
It's great. David, do you want to add a few comments?
Yeah, for sure. I think just to build a little bit on what Brian said as well, I think we're moving in a direction of sort of less and less invasive tests for diagnosis and less invasive treatments as well, hopefully. I mean, as one example in our space, right now, a lot of the testing that we're doing for cancer biomarkers, we have to get tissue, whether that's from a biopsy specimen or from someone's surgery. But more and more, we're looking at how can we develop blood-based biomarkers so that if you've got a tumor on imaging, we can draw some blood, run a profile on the blood, and then based on that, we may not actually need to do a biopsy, and we can sort of decide on treatment based on that. But maybe even to go one step beyond that, can we look at the images on the CAT scan or MRI scan and predict more accurately using artificial intelligence, based on the characteristics of the tumor? Can we actually predict, hey, this is going to be this type of cancer, and it's going to respond to this type of therapy? So these are all things that are actively under development, and hopefully within 5 or 10 years, we would see that come to some sort of fruition.
And David, just building off that, one of the questions was, what role will artificial intelligence, AI, play in groundbreaking work that you're doing to advance precision medicine? But when you think about, what's the role of AI in precision medicine, any further thoughts on that? And then I'll shift to Joanne and Brian for any of their thoughts.
Yeah, I mean, that's a tremendously exciting area, and could probably be a whole separate evening. It's sort of understanding AI is probably well above my pay grade, but I would say that in our program, it is actually something that is coming more and more into use, certainly in the research space. Applying AI algorithms to analyze medical imaging certainly is something that's quite active here in our program and in our research institute. On the lab medicine side, actually, we are changing the way that we're doing pathology, that we've been doing pathology for the past 100 years, in that we're actually, rather than using, so for pathology, usually we, we have sort of a glass slide. Probably some of us as kids, I used to have a microscope at home. You put stuff on the slide and you look at it under the microscope. That's how we've been doing pathology over the past 100 years. And now we're actually changing to be able to generate sort of digitized images of these slides. And that allows us to look at the slides on a computer, but I think more importantly, it actually allows us to analyze those slides now using artificial intelligence-based algorithms to look for features that we, with our naked eye, as pathologists may not be able to pick up, or there may be patterns that our minds aren't able to process, but with AI algorithms, they can detect new qualities and predict new behaviors of these tumors. So this is an area definitely of active research in the program right now.
Great. Brian, Joanne, did you want to add any further comments on use of AI?
Love to. Yeah.
Great.
So, imaging is a huge amount of data. The fact that we take hundreds of megabytes to gigabytes of data in a single CT scan and condense it to a 500-word report, there's a lot of stuff that's in there, right? And so, the doctor who ordered the study or the doctor that's reporting the study has a limited bandwidth to focus on particular questions. And one of the other questions that came up in the chat is, what can precision medicine do for prevention? Well, let's say that you come in for a trauma at the age of 30 and you recognize, okay, there are certain things that are broken that need to be fixed. And that's what they focus on in the report. But at the same time, an artificial intelligence algorithm goes in there and recognizes that there's some early markers for atherosclerosis. And then you send a signal to the patient saying, hey, just watch out. There's a little bit of cholesterol building up in your aorta. Maybe it's going to grow somewhere else. And maybe you want to be a bit more attentive to some of the habits that you can modify from a lifestyle perspective going forward. We talk a lot about how we decide how someone gets a blood pressure pill or gets a statin. And we're going to start seeing imaging to guide some of that because we get so much information from imaging. And then Sunnybrook is ahead of the curve on this in many respects. We just announced, announced about 2 or 3 years ago, a $49 million center for research in artificial intelligence for imaging. And just last week, we awarded $22 million worth of grants out of that center to organizations across the country to do research in artificial intelligence for image-guided therapy. And what I'm doing in my lab is taking those pictures that I told you about and automatically quantifying them and interpreting them for the physician. Because you can imagine, we take pictures during a procedure room, we're thinking about 5 or 6 different things at the same time. Is the patient stable? Where's my next device? What happened to the person I was working with as they went chasing off for something I asked for? And what's my next move going to be? So if you can take some of the time spent measuring things, or if you can have the systems point out certain parts to draw your attention to it, that says, hey, there's a plaque in this area that you almost missed, or there's a suboptimal result that you almost missed, and draw the attention, you can get some workflow efficiencies. So that's one aspect where we are building AI into the platform. Another is actually to improve the quality of the images. The images can get filtered using AI to actually get rid of stuff that's not needed there. And we've got some very interesting intellectual property working in that theme. And then long-term, Sunnybrook has excellent preclinical device development and technology development facilities. We've got excellent epidemiologists, and to be able to take these new technologies and then link how they're used to the outcomes of Ontarians across the province, and identify decision support systems to give people prognoses that are more accurate than they otherwise would have gotten, I think is another area where artificial intelligence will have real impact from a precision medicine perspective. But I like to call it augmented intelligence almost, because artificial intelligence sounds very non-personal and almost like the physician's not there. But what physicians need, just like everyone else and all the other healthcare workers, is a bit of a helping hand. And so maybe it's augmented intelligence to a certain perspective to help us all make sure we have all our I's dotted and T's crossed.
We were just out with a donor recently and having a very similar conversation and talking about how some of this gives confidence to the physician or to the team around the care plan, because it's assuring them on the treatment plan, the diagnosis, the what else is needed, et cetera. But so I think sometimes we lose sight of that.
There's a reason why sometimes people say, I want, the surgeon for this very complex procedure who's been doing it for 20 years, right? Yeah. Because he or she has that network or knowledge of information. And if there are ways that we can maybe shorten the learning curve for some things with this kind of experience that gets amalgamated into an AI system, that's very attractive.
Well, and I love your opening comments, Brian, just around, how we partner with other institutions across Canada, globally, around that whole data collection. I know that's a massive undertaking, and I know we make some great strides in that, but I know it's also important for our donors to kind of understand how we work and come together. Before we shift gears, Joanne, did you want to add any comments on just you know?
I just want to point out that Sunnybrook has been awarded the only 7 Tesla magnetic resonance imaging system in Toronto. And what this will do at the moment is 7 Tesla is the strength of the magnet, just so everybody understands out there. And the stronger the magnet, the more we can see, the clearer the images are. And we'll be able, with the 7 Tesla, we'll be able to see things we haven't been able to see before. And so, as Brian said, this is when AI becomes very important, because we've been trained to look at the brain in a certain way. And these algorithms can look at it with a very clean eye differently than how we're looking at. So we may be able to pick up things earlier. We may be able to understand normal variability from brain to brain that is just normal, and what actually is part of a disease process. That 7 Tesla MRI also will be shared with the rest of the Toronto community. It's not just for Sunnybrook, but it will be housed here. And it'll be housed here because we have the physicists and the imagers with the experience to be able to run it, where no one else does in the city.
That's great. Thanks, Joanne. And Brian, you brought into your conversation a little bit about prevention. And I thought maybe I would shift over to David to say, you know, how can precision medicine also play a role in prevention?
Yeah, I think that's a great question. You know, I think when I think about like, let's say lab-based testing and biomarker testing, I mean, one of the things that I mentioned that we do is or we're working on right now is developing tests that tell you sort of what sorts of treatments you shouldn't be getting. But those kinds of tests we're actually working on expanding to kind of a whole panel to look at genetic makeup of different individuals, to say, okay, what sorts of things might you be at risk for? And you know, even for things like common medications, you know, you maybe shouldn't be taking like the regular dose of aspirin or whatever, because it may actually cause more complications. So, I mean, these are still kind of early days for this particular field and for these sorts of tests. But, you know, so some of these markers I think would potentially address lifestyle types of issues, or, you know, maybe types of, you know, medications, maybe even common over-the-counter medications that people might benefit from maybe avoiding. So, yeah, that's kind of my thought on that particular question.
Great, thanks, David. I'll switch over to a new question, but I'm just going to pause for a moment to make sure that Joanne or Brian, anything further to add on prevention?
You know, it's amazing how information, you know, we're motivated in terms of our decision making by data and confidence, right? And incentives. And if you see something visually that is a strong signal, if you see a picture of an artery that is not healthy, or if you see a picture of a vertebral disc that is bulging in a way that it clearly should not, and you know that's why your back hurts, or you know that's why you have a family history for coronary disease, but you're having a hard time convincing yourself to stretch or to quit smoking or to take on a more healthy lifestyle. When you see that early signal and it's real and it's not people just sort of recounting scary stories to go what happened to other people, but you know that it's you, that can be incredibly motivating in terms of changing a behavior. And that's a big part of healthcare is changing behavior.
That's true. That's a lesson I could take home, Brian. Thank you. There was a question through the audience around, when I make a donation to the hospital foundation and don't specify a particular need, how do you decide where to put that donation? And I think probably I'll tackle that one to start. And so a lot of gifts do come into the hospital foundation, unrestricted is what we call it, undesignated. And that would be first and foremost, we would think to what is the highest priority of the hospital. So we work closely with the hospital and hospital leadership. Many of you will know Dr. Andy Smith, who's the CEO, and we define with him every year what are the top priorities of the institution, what are we trying to raise money for, and we bring things into our priority list, such as the new Hurwitz Brain Sciences Center or the organoid facility that Joanne mentioned, or training fellowships, those sorts of things. And so we would have each year a set of top priorities that we would direct those gifts to, but it's always informed by the hospital first, and then we make those decisions on maybe even topping up projects that are well on their way. There was a new system going into the Odette Cancer Center where we needed, a couple of $100,000 to top up to complete the project. So it might be something along that line. But equally within each of the programs, they have a set of priorities within the programs. And so if somebody directs a gift unrestricted specific to Odette Cancer Center, then again, we work with the program chief and the CEO of the hospital to make those determinations around how to spend the dollars. It's a good question. Okay, and so I think we are getting towards wrap up. I'm just checking on my time. I'm seeing that. And I've lost my closing remarks. There they are. First, I want to say a big thank you. Please, I know at home you're joining me in thanking our panelists this evening. How inspiring it is to hear about your work, and what I hear in all of your voices is a lot of passion, a lot of care, a lot of compassion, a lot of desire to help our patients and their families. So thank you for your time tonight. I want to thank our community for joining us, for your great questions, and for of course, your continued support of Sunnybrook's important work. As you heard tonight, the future of precision medicine is exciting, and the future is already happening at Sunnybrook. And there's still so much great potential on the horizon. That potential, as we talked about, requires support. Certainly philanthropy has a way of unleashing innovation. Your generosity advances new studies and brings the latest technology and equipment to Sunnybrook that translates to the most personalized and precise treatments for our patients, for our families. And your support keeps us on the leading edge, keeps us inspired, so that one day the idea of one size fits all will seem archaic. We hope that you will join us for the second and third installments of Sunnybrook Foundation's Virtual Impact Series. And so just a quick highlight, on February 22nd, we will discuss how Sunnybrook is taking a comprehensive and holistic approach to seniors' health. And on March 7th, we will feature women in brain sciences and hear from some of our most celebrated female leaders in the Hurwitz Brain Sciences program. Each event is a unique opportunity for you to have that front row seat to learn about the impact of your generosity on innovation happening at Sunnybrook. Thank you all for being with us tonight, and good night.